guys, I just wanted to take a minute today and talk to you about doing your confidentiality statement in counseling. When you guys get into your triad groups, as you move into your recordings, you move into your mock counseling sessions, and as you go on into practicum and internship, one of the most important things that you can do at the very beginning of the session is talk to the client about confidentiality. Confidentiality lets our clients know that they're in a safe space and they can talk about whatever they need to tell us about. A lot of times when people come into counseling, they feel kind of anxious, like, what can the counselor do? What can they say? Like, if I say, I hate my children, sometimes I don't wish I were a mom, or I'm thinking about leaving my husband, it can be nerve-wracking because is the counselor going to go and tell them that? Or are they going to try to take my kids away because sometimes I don't feel like being a mom? Confidentiality lets them know specifically the limits of what you can and what you can't say to them. As counselors, we follow the American Counseling Association and the American School Counseling Association Code of Ethics. So, when you are learning how to do a confidentiality statement, it can sound kind of weird because it's a little bit maybe legalese sounding, and you don't want your client to feel nervous or feel like there are things that they can and can't say in the session. And this way, when you make the statement to them, it makes them feel better. It lets you know exactly, what the parameters are. So this is how you will make the confidentiality statement in your videos. First thing that you say, everything that we talk about is going to remain confidential. And then I like to say, do you know what confidentiality means? Sometimes little kids, or they may think they know what confidentiality means, or even, teenagers and adults, they may think they know what it means, but they don't exactly know. So depending on what they say, this is how I'm going to respond. So they say yes, I will say to them, hey, can you tell me what confidentiality means? And if they say no, I'll also say, what do you think confidentiality means? But either way, I'm going to go over the definition with them. Here's what you say. Confidentiality means that what you say in this room will not leave this room. However, there are a few exceptions. And the first exception is if you tell me that you want to hurt yourself or kill yourself or otherwise harm yourself, I'm going to need to report that. The next thing is if you are telling me that you are feeling unsafe. Is someone harming you? Is someone harming someone else? And that makes you nervous or doesn't feel quite right? That's a reason that I might have to share that information. Also, if you say that you have a serious intent to harm someone else, I'm going to have to talk about that. But basically, my job as a counselor is to help support you and keep you safe. And I would rather you be mad at me because I had to report something than me not be someone that's going to be able to help you. So that's exactly how you're going to do that when you're doing your confidentiality statement. Now, there are some possible issues, especially with you clinical mental health counselors. And this is something that you will talk about at the beginning of your sessions. Usually, those of you that are in a clinic or in private practice will have something called informed consent. And at the very beginning, they will have the informed consent paperwork. You will go over that with them and let them know exactly what the parameters are. And so one of those issues might be with insurance. And insurance companies do want counselors to give a diagnosis and a treatment plan. That's how they do payments. So be sure that the client understands that. And also, sometimes court cases, confidential information might be subpoenaed. And so if that happens, you will always want to talk to a lawyer before you share any confidential information. But right now, for practicum, or just for us in pre-practicum, don't worry about saying anything about insurance or anything about court. That's not important for you to know right now. Next thing is something that might be an issue is counseling minors. And when you are working with kids under 18, they don't have the right to confidentiality. So in my practice and in your practice or in a clinical setting, I like to make sure that parents know what I will and won't do with confidentiality. I kind of have my own rules on what I if I'm going to work with a parent, I want them to help follow my confidentiality rules. And basically, I just look, hey, your kid is going to tell me certain things. I'd like to keep that between the two of us. If I feel that there is something that you absolutely must know to help keep them safe, then know that I will share that with you. And most parents are okay with that, and they'll allow you to go through with that. Now, I want to make one more note on self-injury. Self-injury is something you also know, maybe cutting or some type of self-mutilation. That is different. Self-injury is not suicidal ideation. Self-injury is just a coping mechanism that allows some people to change emotional pain into physical pain. I'm not going to go into detail on that anymore, but this is something that in the future, as you start practicum and internship, you're going to want to learn more about self-injury. Read journal articles, talk to your site supervisor, talk with colleagues, so that you will know how to treat this. But just know that self-injury is not the same as harming yourself or suicidal ideation. So what I'd like for you to do is practice on how you're going to make this statement. The more you say it, the more you're going to feel comfortable with it. So sometimes just, go through this video, look at the infographic that I'm going to make for you, see how do you say it, exactly what do you say, and then just say it over and over and over again, and then it'll be second nature, and you won't feel uncomfortable talking about it with any of your clients, even if they're little kids all the way up into adults.